Hello, welcome once again. It's another episode on Time with a Gynae. This is Dr. KK. So, in the last episode, I spoke to you about the second trimester, what you'll be required to do, what you're expected to do. Now, let's move to the third trimester. Third trimester starts from 28 weeks. So, that's like from 7 months to 9 months in the readings of most of the pregnant women. So, in the third trimester, from that time, 28 weeks, hooray, your baby is now considered viable in Ghana. So from that time on, when the baby comes out, we say that you have delivered. It's different when we talk about termination. So from that time, the baby is viable. The baby is a fully fleshed human being. And so we manage as such. So from 28 weeks on, from that time during the antenatal, you're expected to come every 2 weeks for all normal pregnancies, unless there are reasons for which you should come more often. So I always say that I'm giving you the normal schedule. There may be a reason why your midwife or your doctor will want you to come maybe weekly or something aside the normal schedule. So you are required to come every 2 weeks, until you get to 36 weeks. So from 36 weeks, it's changed to every weekly until you go into labor, or if you are scheduled for a cesarean delivery, that is done for you. So what do you do? In the second trimester, most people or most doctors or midwives will make you do two scans, and they are all to assess the growth of the baby. So the scans that you do in the third trimester is usually called the growth scan. So it's used to monitor how well your baby is growing with respect to how old the baby is, or how old what is in your womb is. So all the scans that will be done will aim at checking the growth of your baby. There may be other investigations like your urine, your blood level. At a point, they will repeat the HIV status. So that is also going to be checked in your third trimester. So mainly in the third trimester, these are what are going to be done for you. Growth scan, checking the well-being of the baby. And at a point in the third trimester, if you're at a place where they do what we call CTG. CTG is also a form of a scan. It's not necessarily a scan, but it's also a tool that is used to monitor how your baby is doing. So some of the centers will require a CTG. They will do a CTG to find out how your baby is doing. Some of them also do what we call biophysical profile, or it's a scan. That one is a normal scan that is used to check how your baby is growing, how your baby is doing. They check your baby's heart, they check your baby's brain, they check everything about your baby to ensure that your baby is growing very well. So in the third trimester, these are the things that will be done. Now, all through the pregnancy, all through the trimesters, right from the time, so ideally there's malaria prophylaxis. What we call it is SP. So there are about 3 tablets. They are usually given to you at the antenatal clinic, and you are required to take it there. So we call it like a DOT, directly observed therapy. So you are required to take it there. It's to protect the woman against malaria, because malaria in pregnancy can be very severe and it can affect both the mother and the baby. I'm sure in another episode I'll talk to you about malaria in pregnancy and how to prevent it. So one of the means of preventing it is the SP. SP is given monthly from the time, the ideal time is from 16 weeks. But most midwives or doctors will use the time you start feeling your baby's movement. So from that time, they will give it to you monthly until you deliver. Another thing that will be done is that right from the first time you go to your antenatal clinic, a shot of tetanus injection will be given. That injection is to protect the mother and the baby. They protect the mother against tetanus. It gives the mother immunity, and it can also, the antibodies that the mother makes can be transferred or can be transported into the baby to protect the baby against early tetanus or neonatal tetanus. So that is also key. It's given in every pregnancy. So if it's your first pregnancy, you will receive 2 shots. One will be given, and then a month later, the other shot will be given. The next shot is 6 months later. By that time, most women may have delivered, so they don't receive the 6 months later. But in their subsequent pregnancies, they are given single shots in all the pregnancies until they take the full dose. The full dose is about 7 doses. So every pregnancy, you take one. This is to offer you immunity against tetanus and then protect your baby as well. aside these things, any other medications like the folic acid and the iron that you are given, you take it throughout the pregnancy. And you are even required to take it to about 3 months after the pregnancy. The reason why you're taking it to about 3 months after the pregnancy is to replenish the stores that you have lost, because the baby's development takes a lot of the iron in your system. So if you are not taking enough, you may go into iron deficiency. So when you are giving, you have given birth, it's required that you also take more to replenish what you lost during the pregnancy. So that's why the iron is and the folic acid are continued to about 3 months after delivery. So now you are full term or you have reached delivery. The doctor will plan with you which mode of delivery. Now, this may have even started right from the beginning of the pregnancy based on your status. So, for somebody who have had a cesarean session before, the discussion will start very early. There are peculiar cases for high risk pregnancies where mode of delivery discussion will start early, and that's the ideal thing. You should start early in the pregnancy so that you and your midwife or your doctor will plan together how you want to deliver. If you want to be delivered by cesarean delivery or you want to deliver by through the natural delivery mode. So it's very important. That discussion is very important. The doctor will not make the decision for you. The midwife will not make the decision for you, but it will be a shared decision so that both of you agree on how you are going to deliver. Whichever mode you choose, the doctor will advise you on the pros and the cons, and then you put it together. And at the end of the day, we are all aiming at having a good baby, a healthy baby, and a healthy woman. So that is what will be the target of any midwife or doctor offering antenatal services. So in a nutshell, this is how the antenatal services go in most of our facilities in Ghana. There may be instances where you may be referred to maybe a tertiary hospital based on some issues, but those are peculiar cases. So that is the schedule for antenatal visits. So this is where I'll end the series on antenatal. If you are new, go back to the other episodes and learn more about what antenatal entails for a lot of women in Ghana. If you have any question, don't forget to put it in the chat box. Let's get interactive. This is Time with a Gynae. I want to also encourage all of you, if you have any peculiar topic that you want me to talk about, I'll be glad to do that. I'll see you again. Continue sharing, continue liking my videos, and let us grow together.